Okay, so upon approach, I would knock on the door.
Come on in.
Okay, all right, I come in and I said, introduce myself. Hello, ma'am. My name is Don. I'm going to be, I'm a student nurse from Jamaica, and I'm going to be doing your postpartum assessment for today. Okay, may I ask you your name and date of birth?
Marie Noel.
Okay, and your date of birth?
December 5th, 81.
Okay, very good. I would also ask my patient if, if they mind me being a male, if I was do their assessment. So do you mind if I do your postpartum assessment?
I don't mind.
No? Okay, awesome. I would provide for privacy by closing the curtain behind me. I would wash my hands, okay? Make sure they're dry and they're warm. Okay, very good. So at this point, I would ask my patient, I would ask my patient about her birth history. How many children have you had?
3.
3 children?
Yes.
And I would also ask her about the way they were labor. So were they C-section, were they vaginal births?
I have 2 vaginal births and 1 C-section.
Okay, all right, very good. All right, I'm gonna take your vitals now, all right? So I would assess my patient's vitals. I'm going to be checking her blood pressure with my fake blood pressure cup. All right, okay. You have a blood pressure over 120 or 120 over 80. I'm going to check for your pulse. All right, pulse rate is 88. While I'm doing that, I'm looking for respiration. So I have a respiration of 16, and I'm also going to check her temperature with the thermometer. Okay, and your thermometer read 98.8. All right. So at this point, we're going to go ahead and start the assessment. All right, I'm going to start with the breasts. All right, so I'm making sure that the breasts are even and that they're proportionate. Okay, I would go to, feel the breast, make sure that I don't feel any engorgements or anything like that. Do you feel any tenderness?
No.
No? Okay, I will also assess the nipples, make sure I don't see any inversions or anything like that, or cracks or anything like that. I don't? Okay, very good. So we will move on to the uterus. So with the uterus, what I'm looking for is, depends on how far you are from birth. It depends on how far your uterus is near the umbilical. So what I'm going to do is I'm going to take one hand and I will push down on the patient's belly, right about the umbilicus, and I'm feeling for her uterus. I want to make sure that uterus is a hard melon and not boggy. If the uterus is boggy and soft, it usually is because she's bleeding still after delivery. So the uterus is nice and firm, so we don't have to worry about that. And then we're going to move on to a couple other questions. So while I'm here, I would assess for bowel sounds. So, okay. So I would assess the different quadrants, and I'll find out that my patient has normal active bowel sounds, and I would ask the patient, do you have any issues with bowel movements or anything like that, any constipation?
No, I
Okay,
don't.
and so if the patient did, if I didn't hear active bowel sounds and the patient did, have stuff about constipation, I would give them education about water and fiber and things of that nature. So then we would move on to bladder, and so I would ask my patient how she's voiding. Are you voiding normally? Are you getting up in the middle of the night using the restroom? Or is it really frequent? So normal.
Yes, normal.
Okay. So then we would move on to lochia. So I would ask my patient during discharge, what color is her the pad, after discharge? If it's dark or if it's bright red, or or is it just kind of like a mucusy? During lochia, okay? And then after that, I will move on to her episiotomy and the perineum. I would check, I'm looking for swelling, anything like that, discharge, colors, stuff like that. And I think it's Rita, so redness, edema, ecchymosis, approximation, I'm missing something.
Discharge.
And discharge. Okay, so I'm looking for that. And then I would move on to, I'm checking for, after that, I'm going to check for DBT.
Okay.
So I'm going to check and make sure, no, that's fine. I'm just going to check and make sure that the legs aren't swollen or tight or red, or you don't feel any pain or anything like that. Okay, so none of that. Okay, then I'm going to ask my patient about her emotional status. to make sure that she's not going through any issues or. So I'm going to ask her is, how are you feeling? How are you coping after pregnancy, after being pregnant?
Well, I don't have any depression. No, I didn't go through those mother blue. I don't know what it's called, because I family around me,
Okay.
my other
So
kids and my husband. So we.
Okay, so you have a support system.
Yes.
Okay, so no postpartum depression. My patient does have a support system. And then I'm also going to ask her about Rogam. Would you administer Rogam at any point during your pregnancy?
What is Rogam?
So Rogam is when your child is Rh positive and the mother is Rh negative. So what happens is when that happens, they give you a medicine called Rogam, and that is to prevent the abortion of if you want to be, have another child later on.
No,
Okay.
no, I
that.
never got this.
Okay.
I don't remember having something.
All right. Well, that's pretty much it. Thank you. I appreciate you. All right, and that will be the end.
Thanks
Okay.
for
Very much.
checking.
All right.